A report by the global anti-poverty movement Oxfam SA has found that the poor treatment of healthcare workers compromises the quality of the healthcare and in turn results in the system being ill-prepared for COVID-19. Now, according to this report, the South African healthcare system hangs on the edge of a cliff. This has been blamed on a profit-seeking private healthcare sector combined with underinvestment in an unaccountable public healthcare sector as well as gaps in labour policy. To discuss these findings, we're joined now by Fikile Dikolomela-Lengene, a nurse and deputy president of the Young Nurses Indaba. A very good morning to you, Fikile, and thank you for your time today. I am wondering, what is it that necessitated a report of this nature to be put together?
Good morning, and thank you for inviting me today to give our Lona on the report. I think what needs to be clear is that for long, nurses have been actually complaining about our healthcare system. For long, patients have been complaining also about the very same healthcare system, be it from the private sector, be it from the public sector. But it somehow felt like it is actually coming on deaf ears. Nobody is actually willing to listen on what the plights of the community, the society, and the plights of the nurses are. So this report, I think, came at the very correct time, especially the time when those who have not been listening are now faced with a crisis.
What are those major concerns that nurses have been having over time?
I think 25 years into democracy, we have seen that in the past 7 or 8 years, they've been trying to even change the curriculum of the nursing profession. And it actually hasn't been a smooth go. Why hasn't it been a smooth go? Because nursing has been captured. We were never said by the ruling party or the ruling state, but it actually has not been able to filter through to where it needs to filter. Shortage of resources, chronic service that the nurses need to give to the patients. For instance, look at what is happening in the Eastern Cape. Looting and corruption has made sure that the nurses there, as the frontliners, don't have the appropriate PPE. And at the end, who gets the brunt? Currently now, it is the very society and the very nurses that are actually now having to look at this massacre that is happening to our people.
One of the things that the report looked at, Fikile, was the difference between the private healthcare sector as well as the public healthcare sector. What were the key findings when these two sectors were closely scrutinized?
You know, when we look at nursing is a gendered profession. We're looking at it, 80% is female. And when we look at also, if you want to also break it down in race, it's black women. Now, when you go to the private sector, it became a shame that some of our big corporate companies, nurses, are not actually even in their boards. The number of nurses there, they're actually as economic drivers, only as workers, not only as the people that are key in part of taking decisions and also becoming policy drivers of the nursing profession. Now again, you come to the public health sector. Look at mother and child. Mother and child, when you look at the people that are in key positions, people who are making decisions for nurses, for women, because 80% of people also that are the majority that are using public service, that are using our clinics and hospitals are mother and child. Then you look at the mother and child services. Why are they failing? Why is there so much uproar at the maternity units? Then you find that at the key, the skills of the nurses that are needed to advance midwives, they're actually closed out. They're only left to go to the bedside. Then you will find that is why you are having a woman having to go give birth. As at the clinic, you need to refer a woman 40 to 50 kilometers a day. Those are gender-sensitive issues that we needed women to be actually at the forefront and run those things. And to look at the political will currently, during this pandemic, we have actually seen that the government is able to stretch the services. It is able to identify those areas. Like for currently, all districts now are going to be having a COVID hospital. Why wasn't it possible to have a mother and child unit in every district to make sure that we curb the mortality rate that is happening to our neonates? So those are some of the issues that we find. We also it also got to find the issues of pay disparities. Is it because that nurses are female, they don't deserve pay? Yes, nursing, it is a profession. Rather, we want to masquerade it as a calling. But at the end of the day, those people that we hire as workers, we need them to be having formal qualifications. We need them to be having a certain skill, and they need to be remunerated accordingly.
You also spoke about the impact that COVID-19 has had on the health sector, saying that the gaps have been there all along and needed to be plugged, but only now in the wake of COVID-19 are resources being channeled into the health care sector. Do you think that what is being done now to reform the healthcare sector and to capacitate it in order to be able to deal with COVID-19 will be able to last and have a long-lasting impact on the healthcare sector and in your industry as nurses as well?
What we as an organization have always said, we cannot want to fix problems of the 25 years post-democracy only in 2 months with a COVID budget, while billions have already been looted, when the system could have, at least at this stage, been able to actually, be able to capture the pandemic that is currently happening. We are trying now in these 2 days, in these 2 months, to actually want to answer the injustices of 25 years. It is not going to be possible. Currently, we are even looking at the current guidelines that are there in the system. They are not gender sensitive. Number one, they are actually contravening the human rights of the current workers. The nurses currently, I will even speak about myself. Currently, I'm on quarantine as we speak. I'm a frontliner. I work in a clinic. Nurses currently, we don't have the appropriate PPE. And then at the end, we are supposed to go there and fight. Fight with what? Our job is to save lives. And we need the tools of trade for us to be able to do that. Now, the COVID-19, the pandemic, has actually opened a lot of questions to say, are we ready for the NHI? If there's a province that can loot the funds within 2 months of one pool, that actually mimicking the NHI concept that they are trying to thrash down our throats, and we're failing currently in this system, what are we saying about ourselves as a country?
What then is the solution, Fikile? I mean, you've outlined the problems very succinctly there. What then is the way forward?
I think the way forward that we have always called upon to the president, Mr. Cyril Ramaphosa, we need to see looters going into jail. Currently, it is not about the few, it is about the massacre that is happening. And I think also the solutions that we need to, the society needs to stand up. I think if it comes maybe to your back door, that is when you want to act. Let us not wait until it is you, your mother, or your child for you to actually take a stand. We saw it happening in the Cape, in the Western Cape, and the society actually, we did not put much effort or put much pressure on the people that we have put into office to say that whatever it is happening there, it is an injustice. We need to actually strengthen our lines to fight. Now it has come also to the Eastern Cape. Again, we are seeing that province crumbling under the leadership that we've put through. And there is nothing that is happening. Monies are missing. We haven't seen people being put into jail. Gauteng currently, as we're speaking, Netcare has got almost 10 of its private hospitals that are diverted. So it is actually going to come into our back door. So hence we're saying to the society, we're saying to the very frontline workers, we need to stand up. We need to call. The president needs to start looking into the workforce that he has actually put in place, and the resources needs to be channeled correctly and actually reach the ruralist areas at this point in time.
Fikile, I'd like to ask you this question as a frontline worker, as a person who is actually on the ground working in the healthcare system. You made reference now to the NHI and saying that the current structure that has been put in place is supposed to mimic the structure of the NHI, but clearly it's not working because of issues of corruption and non-accountability. What then do you think should be done? Do you think that the NHI is the way to go, or should South Africa go back to the drawing board and create a public health policy that is implementable and that it will be able to hold those in authority to account while also delivering quality health care to all South Africans?
The universal health coverage is a realization that we need as a country. The inequalities in the healthcare system that have been there post the democratic state are unbearable. And they have shown that the resource distribution, 16% of the population are on medical aid, and the 80% are left to fight at the end, gribbling for the miagra that is left for them. Now, the universal health coverage surely is a realization that our communities need. But the NHI bill, how it was structured, it still mimics the privilege having to still become privilege because of them having to top up medical aid still being there. We are actually not addressing the issues of Lusikisiki, of a grain who is not getting panado. We are actually not addressing the issues of the nurse in the rural of the KZN who doesn't have any IV line. I will shock you that even now in Gauteng, our MOUs, our casualties are running without IV lines. You have to choose as a midwife at the end of the day, which child do you get to save? When a woman, 5 of them come at the same time, you need to choose because human resources has not been staffed to actually meet the demands of the community. Definitely going to the drawing board, the NHI needs to do that. Definitely the one pool that only the minister sits in all the boards is a problem as we're talking right now. Look at the COVID-19, look at Eastern Cape. Those are just a few examples. We need to go back to the drawing board of the NHI. How it is structured and how it is going, and how it is placed, it's actually going to compromise. Look at the CHWs. Right now, we are actually expecting women using 3.5 who are earning 3.5 on contractual basis. When it has become unconstitutional for a person to work more than 3 months without them being permanently employed. Yet now we have found out that last week they have actually been signed an extended contract. What does it say to us about those that we put in power?
Well, thank you so much for that insight right there from the front lines. That's Fikile Dikolomela-Lengene there. Thank you so much, ma'am, for your time and your insight this morning. She is a nurse as well as the Deputy President of the Young Nurses Indaba.